Welcome, everybody. This is concludes our week of all calls, although we are expecting a visit from Jimmy Faila, whom will be joining me along with Kat Timpf and I think Kennedy at the music hall in the Chelsea Music Hall under the Chelsea Market on Monday. That's next Monday, so do check us out there.
8:30 p.m.
8:30 p.m. And
in Chelsea.
In Chelsea at the Chelsea Market.
I'll be there too.
Susan will be there. We'll hang out afterwards. We'll love to answer questions. But today we are answering questions on any topic. Again, we're at a special time. We go back to our usual schedule next week and usual guests and whatnot. Though there's a little flyer for what's coming up. All right. So we are on Twitter Spaces. You raise your hand there. You come up, ask me anything, really on any topic. Hopefully we can.
Should we also mention that if you go to drdrew.com/NY comedy and use the code Drew, the tickets are 50% off, okay, for our listeners, and that's 50% off $30. So the ticket will be $15. So bring a friend, get some butts in the seats, and ask us some questions.
And we'll tell you more after this.
Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say.
I think everyone knows the next medical crisis could be just around the corner, whether it comes in the form of another pandemic or something much more routine like a tick bite. You and your family need to be prepared. That's where the wellness company comes in. You know the wellness company. We have their physicians on like Dr. McCullough frequently. The wellness company and their doctors are medical professionals you can trust. And their new medical emergency kits are the gold standard when it comes to keeping you safe and healthy.
It's a safety net. It's an insurance policy
absolutely.
That you hope you're not going to
100%.
need, but if you need it, you sure as heck are going to wish you had it if you need it.
Be ready for anything. This medical emergency kit contains an assortment of life-saving medications, including ivermectin, Z-Pak. The medical emergency kit provides a guidebook to aid in the safe use of all these life-saving medications. From anthrax to tick bites to COVID-19, the Wellness Company's medical emergency kit is exactly what you need to have on hand to be prepared. Rest assured, knowing that you have emergency antibiotics, antivirals, and antiparasitics on hand to help you and your family stay safe from whatever life throws at you next. Go to drdrew.com/TWC. That is drdrew.com/TWC to get 10% off today. Just click on that link. Speaking of TWC, I think people have seen some of the announcements. We are getting very much involved with TWC, and I'm coming up with some of my own packets that I think my greatest pleasure in working with TWC is that they are trying to restore the patient. Put it this way. The most efficient unit we have in medicine is a well-informed caring physician and an informed, motivated patient. That's your best unit. Anything you put on top of that is a mess. Now, the physician part has become adulterated by being employed by a hospital, insurance companies. There are a million, we're aware of the drug companies and what they're doing. We've been adulterated a million ways, so we have lost that battle. It seems to me the way to fight it, an alternative way to fight it, is to put the locus of control back in the hands of the patient. And that's what TWC is interested in doing. That's what I am interested in doing. So I'm happy to be a part of that. And I will mention again, so it makes Susan very happy when I talk about this Monday, November 6th. We're going to be 8:30 at the Chelsea Music Hall. We're going to be answering your questions. Me, Kat Timpf, Jimmy Faila, and I'm hearing now Kennedy. Is that true, Susan? Is she actually going to be here?
Yeah, I invited her, and she goes, "Oh, you mean to be on the show?" And I was like, "Oh, yes,
okay, why not?
Of course. So it's going to be a total shit show."
Here's something interesting on the Restream. Dr. Drew is a Scientologist. That's why you can get away with everything. I've never been to a Scientology anything, but that's an interesting accusation. In fact, I was attacked by Scientology several times. Once I was sort of speculating why people who seem so competent and rich in terms of their contribution to the world were involved with this thing, and they attacked me for that. So be that as it may, we are out on what's a new one? That I'm a Scientologist?
That's a new one. Yeah, that's one I have not heard yet. It's been a long time. Never heard that one.
We said it.
Let's see if anything else.
Thank you, Mika. Made us laugh.
Oh, Tom Cigar is going at it. Thank you, Tom. Tom is on the trolls fast, boy. He's just like, what do you mean?
Yeah, but he's over on Twitch. He's not on YouTube.
Well, he's on the restream where I get to see him. And also, we are. I see Susan over at the Rumble Rants. You guys are all there. Thank you for being here. And again, we were out on the restream. We were taking your questions there. You raise your hand, and we'll bring you up. I failed to mention on Susan's behalf that if you go to drdrew.com/nycomedy, is that correct, everybody?
Yes.
You can get a coupon using code DREW to get
50% off.
50% off the show.
Online.
Monday night, 8:30, Chelsea Music Hall.
Come
under
on,
the
New
Chelsea
York.
Market.
Show up for us. We want you there.
Surrounding area.
I'm excited. It'll probably just be like 10 people and then us.
It could be even more fun. Who knows?
We'll have
It'll
a
be very
bigger
interesting.
panel than the fans.
That's really funny. Or we'll have just our friends in there.
Everybody wants to be on the show.
So I want to sort of get something out of the way right now too, so we're not talking about this after the show. Do we have next week's schedule set up, Caleb? Is that our usual time all the way across?
I'm not 100% sure, and I'm afraid to say it with my baby.
You know what? We have Christina Anderson on Tuesday,
Yes.
and that's going to be at noon Pacific because she is that EU leader who is in, I think, UK, and
Possibly
she's about 8 hours later or 7
11
hours
Yeah, and we're
later.
going to give her an hour because we got to pack up right at the top of the hour because I have to jump on a plane.
Right. And I love that we're doing this at the beginning of the show instead of the end this time. Wow, we're really mixing things up. But,
Oh, shh.
my
You know what?
calendar.
Let me
Let me just
pull the curtain back here.
Oh, yeah.
Go ahead.
My calendar, what it
You wanna tell
says
me?
is that on Tuesday the 7th, that at 11:30, it's 11:30 a.m. Pacific time is whenever we have the show. Then on Wednesday the 8th, the show goes back on to 3 p.m. Pacific, and then on Thursday the 9th, it also looks like it could. It's,
Same.
I'm not. Same.
Correct.
Same, yeah.
Correct.
From Austin.
And they'll be from Austin, and the Tuesday will be from New York with Christine Anderson. Kelly
Fingers
will be here
crossed.
on Wednesday.
Yeah,
Kelly's
and-
going to take over. If
Tune in to those
I
Austin
think-
episodes.
I think
we
it's
found
actually-
a new studio.
Yes, it would be very interesting. And I think it's going to be actually noon on that Tuesday, according to my last email from Emily Barsh. And I'm sure she's listening and will text us if there's any change on that. Okay. The other thing is I want to pull the
take
curtain
some
back.
calls.
Okay, well, in just a second. I'm getting so many texts that I think, Caleb, the arrival of the baby has sent us all off our rockers. And so apologies to everybody.
Not me.
We know what you're dealing with out there trying to raise
I got
an infant.
hacked on Facebook, so
Susan
that
got
sent
hacked.
me off.
Just a whole confluence of factors have come to bear recently that are making everybody off our rockers. That's about the best way to describe it. So let's go
Speak
to
for
some
yourself,
calls.
sweetness.
I am off my rocker. This is AKA Mr. Roper. We'll get him up here and see what's going on with Mr. Roper. And you have to be sure to unmute your mic.
Hello?
Mr. Roper, hey there, go right ahead.
Hey, how's it going, Drew? I had a couple of questions.
Good.
One comment on the Scientology thing. I think one of the reasons that so many competent people are hacked by Scientology is that they crave praise, and I think that the Scientologists they know how to hack people's brains a little bit and their emotions, and so they give them ultra praise, and they do the NLP thing, and it's a good way to get them in.
Well, they do all sorts of organizations like that do this thing called love bombing as a way of getting people
There
in.
you go.
And they are particularly, look up love bombing if you want to see a really interesting technique, and it works if you're not aware it's happening to you. And they are particularly focused on celebrities. They really put a high value in bringing them in. So that's where they really give a lot of love bombing and resources. So, and I'm sure it works for people for a period of time, but it's that all in. Always be very careful when anyone wants you to be all in or all out on any topic or any club or anything. It should never be all in or all out. That's a disturbed circumstance when you're being required to be all in or all out.
Sure. I had one question
what's up?
also to go along with that. So about a month and a half ago,
Okay.
it's about 1 o'clock in the morning. I go to sit down and I feel this really, I sit down and I feel this really strange pulsing just at the base of my neck, kind of behind my sternum, but just under my neck. And it really it felt like a heart thing. And it went on for about 20 seconds, kind of scared me a little bit. I took a couple of aspirin and it went away. I went to the ER the next morning, about maybe 10 hours later. They pulled a blood test. They did a EKG. They did a chest X-ray and a few other things.
Okay.
So my blood test shows not an elevated troponin levels. It was like 2.3 or under 2.3.
Yeah.
And as far as the EKG goes, it says I have a sinus arrhythmia, a right bundle block, and the cardiologist said that he couldn't hear my pulse at PMI. Do you have any idea?
Okay.
I mean, I'm reading all this stuff and I'm looking at all these different things and I'm seeing like, enlarged heart and, pericarditis and myocarditis. I'm not vaccinated, but I had a pretty intense Delta COVID in 2021. And I'm just
do you
wondering,
have an enlarged heart? Wait, hang on. Was the heart enlarged?
Well, I haven't had a on the X-ray. It didn't show that, I guess, but I haven't had an echo done yet.
Okay.
I'm waiting for that still.
Okay.
But when I was 16, I'm 35 years old now. When I was 16, I had a doctor tell me that I had an enlarged aorta by 10%.
Yeah, that's a hard thing to judge, particularly that small. Well, you had a CAT scan for some reason? Is that why they saw that?
Well, I was getting a physical for water polo, and the doctor was like, "I'm sure you don't have it, but maybe just to check Marfan syndrome." I think my chest kind of protrudes a little bit, and in the middle it sinks. So he wanted to have me see a cardiologist just to make sure. And they looked at it, and he said, "Your aorta is about 10% dilated, but other than that, you're fine. It'd probably be fine." But of course, I didn't. He told me to keep an eye on it, which of course I didn't do, and instead, smoked for the next 18 years, pretty heavy, and
that's not good. I'm glad you're not doing that right now. Well, so that's called pectus, right? Pectus excavatum, and that is sometimes you must be a tall person. Also, it made them think about Marfan's. But the ability to assess an aortic diameter within 10% is kind of a inexact science. So I wonder if that's real. Probably what you had was just PVCs, right? Which are really common. Which is your heart's going along, it's bump, 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 bump. Pause.
Yes.
Bump, 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 pause, boom. And that's PVCs.
That should be a clip.
Those are normal. And the rhythms you have to worry about are either irregular, like ba 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 all over the place, or fast rhythms. Ba 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 ba. Those are the more concerning rhythms in your age group with a normal heart.
Okay.
The fact that you have a right bundle branch block can be incidental. I had a right bundle branch for a while. It went away, strangely. It was when I was lifting heavy weights. I had it. With your smoking history and stuff, I think it's good to see a cardiologist, but I think it's probably just plain old PVCs. Okay?
Thank you so much, Drew. I appreciate it.
Hey, how does somebody your age even know who Mr. Roper is?
Oh, I'm a big fan of the show. I watch both iterations of the show. I'm kind of an old soul. I was listening to you guys when I in the mid 90s when I was like 8 years old, 9 years old, and I kind of got exposed to a lot of 70s, even like 60s TV. So I love all the 30s and 40s Hollywood and all that. So I'm kind of an old man.
Adam and I lately have been analyzing The Partridge Family and Love Boat to shine a light on how fucked up the 70s were. But there you go. So they were a mess. Trust me, they were a mess. The fact that we're doing anything remotely like that these days is ridiculous. Okay, this is Money Penny. And I beg your guys' patience. It takes a second to get the guest up, and then it takes even a second further after that to get the mic unmuted. So, Money Penny.
Hi, Dr. Drew. Thank you for taking my call. I'm coming up to 4 years of long COVID. Can you hear me okay? Yes?
I do,
4
but
years
that just
of long
sounds awful.
COVID. Yeah, it is. The worst thing is that I thought I was 80% better, and then something happened and I took a massive dive again. I've got a question pertaining to connective tissue illnesses. This is through the rheumatology explorations I've had. I'm having a hell of a lot of neuralgia, and I've got non-sero rheumatoid arthritis, osteoarthritis, cerebral vasculitis, and a number of other vascular and thrombotic type illnesses that have been identified. But as a whole, the group of long COVID people that are sort of 2 or 3 years plus in are seeing a huge amount of connective tissue illnesses, but they're not coming up as being autoimmune. The ANA, the ACA, all these tests that are done are not coming out positive. Can you explain why and what the significance of that would be?
Okay, I'll just tell you where my head goes. First of all, I mean, if you have vasculitis, it's hard to call that long COVID. It's almost like you have a second illness now. And so I would imagine that and I don't know if it's incidental or caused by the COVID or who knows, but the treatment modalities that would work for the more traditional notion of what long COVID is, you're in a different category, right? Do you understand that?
Yeah, I was perfectly fit beforehand, though. I had absolutely nothing other than a bit of hay
I
fever,
understand.
No, so
I'm not saying it's disconnected.
Lowered immunity. Yeah, possibly.
I'm not saying it's disconnected from COVID. I'm saying you're in a different realm here with these specific conditions. But let me tell you how they hook in together in my mind. I've been convinced that the majority of particularly long COVID and some of the pathologies of COVID itself is an endotheliitis, right? That there's something about this spike protein, it's interacting with the lining of our arteries in such a way as to create an inflammatory activation, both in terms of cytokine and immune cell activation. And if that continues on, it makes sense to me that you'd ultimately get a full-blown, what we call vasculitis, which means vessels are being destroyed by the endotheliitis. I've not seen that before. You're the first person I've spoken to that has that, but it makes sense to me that it could go on to that. So have you been treated with more traditional immune modulatory sorts of interventions?
No, I've just been offered steroids, prednisolone, and hydroxychloroquine. I've been offered, which I turned down. I'm not vaccinated. I mean, I had the original Wuhan strain, so my spike protein is from the original virus itself. Yeah, it's from COVID. It's not from, an interaction of a medical substance that's been given to me. But I thought I was out.
Listen, I had long COVID.
Feeling better.
I had long COVID twice. I had not from the vaccine. I had long COVID twice. Both times I had COVID, I had long COVID, and it catches your attention. And I thankfully only had it for a few weeks, but it's miserable. It is truly, truly miserable.
Yeah,
so
I'm disabled.
my heart goes out to you. Yeah, I understand. It's a terrible illness, and they're saying now 7% of adults may get long COVID, but the vast majority resolve.
48 million are confirmed. Yeah. 48 million people confirmed.
I wish. The one thing I would say is take a good look at whether or not any of the anti-cytokine, anti-interleukin, anti-interferon interventions that we were doing back in the day of Alpha and Delta might have a role to play here, because you have that kind of activation. So, I mean, that it's kind of how COVID would do its thing acutely. You're getting in sort of a long form. So it makes sense to me that some of the things, tocilizumab or who knows what, maybe leronlimab, or these other things that we used to think about for acute COVID might have some utility in this awful thing you're dealing with. I'm so sorry. This is Queen of the Juice. We'll get into it, and then we'll continue to take your calls. I'll look over on the restream while we're waiting for the Queen of the Juice to come on up. Here's somebody saying, enough with the long COVID. Hang on one second, Queen. Was that a short, long COVID? Was that a short, long COVID? I don't know what DE means by that. Yes, Bando patches, 7% is a lot. But the vast majority of those resolve. They don't end up like our last caller. I got better with fluvoxamine and learning language and exercise. But the first time when I had bad COVID, it took a couple months. The second time when I didn't even know I had COVID, it was like 2 weeks. But it's a very characteristic feeling I got. Sorry about that. Queen of the Juice, what's going on?
Hey, Dr. Drew. Hey, I've actually Hey, I'm actually more concerned about the trauma-based mind control with the media and the scare tactics that they have used, and what effects that's had not only on the elderly, who are for the most part isolated already in our society, and then on the young, and knowing now that the shots, they don't stop the illness and they create additional problems. We know that the CDC has said that. I want to know, why are doctors still telling, especially the elderly and the most vulnerable people in our society, to take these shots that they know don't stop anything. They know cause
So
additional problems.
I'm going to attempt. It's a good question. Let me attempt to answer. It's a big question. So when the COVID outbreak first happened, I thought it was all at the hands of the press that were trying to whip up panic. And I knew panic could only make things worse. So I was very angry about this. I was saying, don't listen to these people, don't listen to them. I didn't know the government was involved at the time. I should have thought of that, because I worked, under the behest of Dr. Fauci back in the days of AIDS, and we used a lot of fear back then too. It's the wrong thing to do. But this, in the present media environment, where it's 24-hour news cycles and they have no conscience in terms of using fear, and then social media was out of control. It's a new era where fear is terribly destructive. And they continue to use it. They continue to use fear to capture eyes without concern for what that does to you. I would urge you to look at people that were 8 to 15 years of age during the lockdown. Imagine you were 9 years old and someone told you, shelter in place, which is what you tell somebody when a nuclear missile is approaching. Shelter in place, or you're going to kill mom and grandma. You're going to kill your family. And we're going to take you away from your peers for 2 years. Imagine what would happen to you. Of course, the mental health consequences are profound. Of course they are. And by the way, in the meantime, you'll lose your educational milestones, but we'll give you a screen which will expose you to pornography and sexting. Have at it. It's really been just an awful misadventure that harmed young people, which, in terms of years of life lost, we got to remember that we were very focused on nursing home patients and the very elderly, which was appropriate. But in terms of years of life lost, the average life expectancy in most studies for a male admitted to a nursing home for long-term care is 6 months. That's the average life expectancy. If you're harming people that are 9 years old, that's 70 years of life you're affecting. It's a very different responsibility, a very different thing. So that's one side of what I'm concerned about. Now, then you asked about, in any event, I overstated myself and I got very angry about it and hubristic, and that was my mistake. And I missed some things because of it. It's important for all of us to not have irrational certainty on anything. To be certain is irrational. We need rational uncertainty. That is James, Dr. Fryman's frame on things, which I thought was just perfect. Irrational certainty is irrational. Science, biology, it's all uncertain, and you can be rationally uncertain and still make good decisions. Hubris is not in the game. Now, then you asked a separate question, which was about elderly and vaccines. So I'm someone who vaccinates elderly patients, and I've seen 0 side effects. I have many hundreds of elderly patients, 0 side effects, and considerable benefit. You have to remember, in elderly patients, things get very complicated. There are often times, like I had a patient with liver failure and tuberculosis who got COVID, whom I couldn't use Paxlovid on. Paxlovid, I've also seen that work extraordinarily well in the elderly. So it's a different question vaccinating a population who has a lot to gain. By the way, they get much sicker from COVID, or lives are much more endangered by it, versus somebody who has essentially no risk from COVID, like a 25-year-old male, and who has a finite risk of myocarditis. We can argue about whether it's 1 in 4,000, 1 in 8,000, 1 in 50,000. The risk of dying from COVID is not 1 in 50,000. It's like 1 in a million in that age group. It's very remote, or let's say, at least say 1 in 100,000. And these are different considerations, vaccinating certain populations versus another, treating certain populations with a medication. Paxlovid was only studied over age 65. So we really don't know what we're doing with that medication under age 65. And by the way, it's going to be $1,300 now. Is that worth it? We don't know. We don't. I mean, it's a very significant cost benefit consideration. So the point being is stay uncertain. Constantly try to get more information to approximate the truth. We'll never get there. We're always trying to get there. We will never get there. We just get some approximation of it. But try not to go all one way or all the other. Keep an open mind. That's my best advice. What do you say to all that, Queen?
I'm still very concerned about, because the elderly, they've been taking all of these flu shots most of all their lives, and we've never gotten even the right strain of flu. I feel like they've been vaccine damaged their whole lives, and that's why their immune systems are so
let me just push back on you. Let me just push back. We are having no problem. I'm having no problem getting people into their 90s, in good shape. I mean, there's always a fall off. I would recommend Peter Attia's book if you want to read about longevity. It's called Outlive. And there's always a fall off at some point in your 80s where you lose muscle mass, you lose mobility, you lose cognitive function. It just happens to the human. It's just how we're genetically set up. And I'm not seeing that happen. That's happening at later and later times in life. We've been pushing that back consistently. People have been living longer, better. I don't see anything like that in my patients being injured or damaged by anything. I just don't see it.
Well, I'm coming from a person who most of my grandparents have gotten cancer and, had the end of life protocols of getting overdosed with opium by hospice. And that is what the medical establishment seems to, making us medical debt slaves, womb to tomb. I'm someone, I was always vaccinated as a child. I was sick. Now as an adult and I don't get the vaccines, I never get sick. And so my immune system has gotten better.
Philosophically, I am actually with you. I want you to have control of your health care. I'm in that mode now where I think that is a critical focus. I think it's going to become my life going forward, is trying to put patients back in the driver's seat, but helping them do that in rational ways and safe ways and best risk reward analysis ways where they are helped in those decisions. And they're not easy. I make them all the time for patients. Indeed, those are not easy decisions to make. And so I'm philosophically with you, but I would want to talk more, if you were my patient and I were giving you control of things, I would want to talk more about some of the decisions you're making and why you made them, and, advise you to educate yourself more in certain areas. And then we would go forward. I want you to have control of your healthcare. I like that you're thinking that way. I have to take a little break. Thank you for that call. We have many more calls to come, and we've got Jimmy Faila stopping by after the break. Susan and I have been looking for nutrition-packed, great-tasting greens drink for a while. And then we tried our friends at Paleo Valley's organic super greens, which is superior to what's out there on the market. Our friends at Paleo Valley, well, they think of everything, and they've created what's been called a magical green powerhouse. All three delicious varieties, pure unflavored, strawberry lemonade, and tropical, contain 23 certified organic, antioxidant-rich superfoods, including the highest quality spirulina. It's also free of cereal grasses, gluten, grains, soy, and dairy, and no added sugars or artificial sweeteners. And what's more, it delivers digestive enzymes, polyphenols, which are believed to burn fat, and 8 essential amino acids. Imagine the time, effort, and cost of trying to make this yourself. It's impossible. Head on over to drdrew.com/paleovalley, and you will get 15% off your first order. All the great products they have there, 15% off at drdrew.com/paleo, PALEO. Fall is right around the corner, which means dry, flaky red skin from allergy season is coming with it. But the best way to take care of your skin is with our skincare secret, Genucel. You don't need to worry about that puffy, tired eye look or those annoying dark spots or even dry, flaky skin, because Genucel Skincare has you covered. Susan and I love our Genucel products so much, we want you to try our personally curated skincare bundles. It's risk-free at Genucel.com/Drew. Genucel works so well, you can see the results in this unplanned live moment on our show when the redness repair cream repaired my skin in just minutes right before your eyes. Their concentrated vitamin C serum helps keep your skin plump and hydrated. Plus, with their immediate effects, you can see astonishing results in under 12 hours. Quick, effective, and easy. Go to Genucel.com/Drew right now to try our bundles and save over 60% today. And remember to enroll in Genucel's world-class concierge program for additional savings and free shipping. Don't wait. It's Genucel.com/Drew, GENUCEL.com/DREW. These products have transformed my life and Susan's and saved our marriage. Discover the key to oral hygiene, regardless of your current daily dental routine. Whether you diligently brush and floss multiple times a day, or you struggle, you got bleeding gums, bad breath, plaque buildup, this revelation is for both of you. Surprisingly, over 350,000 Americans experience health issues that may be connected to their toothbrush or even caused by it, ranging from heart or blood sugar problems, forgetfulness, digestive difficulties, immune issues, all related to oral hygiene. Scientific studies have shown that a simple switch of your toothbrush can lead to a healthier teeth and potentially save your marriage. Yes, save your marriage. Our study, we did a personal study. My wife, Susan, hates the sound of the sonic toothbrushes, but introducing the Real White Sonic toothbrush, of course, also their hydroxyapatite dirty mouth mineral toothpaste by Primal Life Organics, these products have transformed my life and Susan's and saved our marriage. It's much quieter. It's a very powerful toothbrush, but it is quiet and it saved our marriage. So, the Real White Sonic toothbrush from Primal Life Organics stands out among all other electric toothbrushes I've tried. It effectively eliminates plaque, harmful bacteria, promotes gum health. Get yours and enjoy 60% off at naturaltoothbrush.com/DREW. Welcome back, everybody. We are taking your calls, and I'm getting mixed messages about whether Mr. Faila is ready to rock or not.
He's ready.
No, he's ready.
Okay, because
I don't know. We'll see.
You guys are blowing up my phone with all kinds of texts.
He said he's in his seat, ready to
including
roll.
Jimmy's not in his seat. Jimmy,
He's
welcome
a
to the program.
He's a pro.
Hey.
Jimmy Faila.
Yeah.
Hey,
I don't
buddy,
know if
how
you
are
heard.
you?
Better now. I don't know if you heard, but Susan's a bit of a texter. So there was a
Oh my God.
little back and forth over who was where and when. And,
Yeah, and I tell her, like, you're blowing, I'm trying to do a podcast, you're blowing up my phone. What did I say? What did I do? Like, I just thought you needed to know. Like, okay. Just saying.
No,
At least
I
you're
love
not
Susan.
getting the...
No.
Me too.
Susan is a human group text. Like, and I do mean this. I enjoy her enthusiasm for the text. Drew, she texted me yesterday about this and then went on for 9 minutes about an Uber ride she had taken recently in San Jose. It was like, what is even happening? It was amazing.
So,
You were a cab driver. I thought you might appreciate it.
yeah. So Jimmy, okay. So Jimmy, this is a great example. So you have to speak fluent Susan to speak Susan. I would have known that she would have been in her brain thinking about you as a cab driver when she launched into that Uber conversation. But you have to translate in real time or you'll miss a whole lot.
It's a lot going on, man. I'm just
tell me
getting
to stop when you want me to stop.
No, we love you, Susan. You're the best. But it's like I said, there's this infectious enthusiasm to your texts that it's a lot. It's like it's drinking out of a fire hose, and I mean it in a good way. But it's only now, Drew, that you invoked me being a cab driver that I even stopped to consider why you were telling me this, because it was just. It's not like you wouldn't just tell me something like this anyway. But now it makes sense.
Oh no, listen. My kids and I read her text back to each other for comedy.
Well, tell the story about what happened in the Uber.
The Uber was, again, there's a whole conversation she just had with herself that prompted her to tell me this. I'm aware of it. I can read her brain now. It's crazy. I can read her mind exactly. So the fact is we were in San Jose. We ordered an XL Uber. This guy pulls up in a minivan with like suspect name of some kind of company on the side, opens up.
Said American.
It did not look like a XL, but we jumped in. We were on our way to the airport. And we quickly got on the freeway, and car would not go over 35 miles an hour, I noticed. And I thought to myself, well, it really isn't road safe for over 35, so this is fine, even though we're on a freeway with people zooming past us. And then my wife, who's, in addition to being an expert texter, group texter, she has a nose that is phenomenal. And she goes, something's on fire. Something's on fire. I smell smoke. And about that time, and I thought at that time we're sort of getting towards the off ramp. I'm trying to calculate in my head how many more yards we have to get to the pull up on the airport. I'm thinking
we coasted off the ramp.
Yeah, I'm thinking even if this thing's on fire, we're going to make it. So I kind of shut up, and the whole engine catches on fire just as we pull up to the luggage drop off. And the guy gets out of the car, and she starts speaking to him in Spanish, which is a language he did not speak.
Yeah.
Nor English.
He didn't know what fuego meant.
And she was going, fuego, fuego. And he's like,
He opened the hood and
he opened the hood and smoke billowed out. He closed the hood and drove away. So to get his next customer.
5 stars. You got where you needed to go. 5 stars. 5 stars. His work is done.
Scary.
I love this.
So you're going to join me. I don't. How long do I have you today? Like for just a few minutes? Is that what we're doing? There. You're going to join me and Kat, and I guess now Kennedy, because the group text kept getting bigger, and eventually Kennedy got caught in the collateral crossfire. Now she's on the show. And so it's going to be the Chelsea Music Hall, November 6th. Be there at 7:30. Shows at 8:30 beneath the Chelsea Market. Tell people about your Fox Across America show also while we're talking about this stuff.
So Fox Across America is obviously, it's a terrestrial radio show here at Fox News. It's on weekdays from noon to 3. And obviously you can get the podcast on the Fox News app or anything like that. But yeah, we're on about 155 stations across the country. And I tell you this, Drew, my radio superpower is the fact that I don't have one. I am very much a regular person having a conversation like you do a talk show. I do a talk show. Most political radio is either a staunch right-wing advocacy hour or the complete opposite. I do mean this. It's not like shtick. Like, I'm not doing a Republican talk show. I'm doing an American talk show. I'm trying to find people who will just have the conversation, because it's so much more productive than just screaming at people to vote one way. Because if somebody's changing the station and they don't agree with it, now they just got an angry guy, you're not going to win them over. So, we're doing the whole, you can catch more flies with honey than with vinegar. And our honey is like a honey vodka. So it's that much more sticky.
It's a laughable honey. And so it is that kind of material we're going to be getting into on Monday, November 6th. You can get 50% off tickets to the Chelsea Music Hall at drdrew.com/NY comedy, one word, and use the code Drew. And when you check out, you get 50% off. And Jimmy, I think one of the reasons people are willing to have those conversations with you, it's that history of sort of blue collar working, driving a cab, that kind of stuff. I think people really relate to that history that you have.
Yeah, I think most of the people out there, they don't want an academic in this moment when it comes to politics. They don't want to Google which House resolution didn't pass because of a cloture vote. They just want to hear a person give it to them in a language they understand. I mean, again, that's kind of the hook. Like, I am communicating at a 3rd grade level, but a 3rd grade level allows you to, process what I'm saying, have an opinion on it, and feedback. And I think that's the biggest challenge of right now, is a lot of people want to show the world how smart they are. But a lot of times that doesn't make for a good conversation. If I've got to Google every 3rd thing you're saying, we're not really having a give and take. So my show, I say this, Drew, like, it sounds like we get paid in tequila and Tide Pods. And that's partly because it's true, and mainly because, like, that's the vibe. That's what you want to do,
Yeah. Were you ever much of a student of American history?
Yeah, but not on a level where anyone listening to this would copy off me on a test. But whatever you invoke, I'm probably
I understand.
semi-versed in it. Yeah.
Yeah, but I know Kilmeade, who precedes you, is very involved in history and he's very much considers himself kind of a student of history.
No, he's unhealthy.
No?
No. Kilmeade likes history the way everyone knows a little kid who likes dinosaurs too much and works it into every conversation. You're like, hey, Ricky, how you doing? I like dinosaurs. Like, wow, thank you for that, Ricky. I was just saying hello. That's Kilmeade. You see him in the elevator. I'm like, how'd the show go? It's like, Samuel Jackson and Frederick Douglass had a conversation on May the 9th, 1852. I'm like, whoa, what just happened here, Kilmeade? Non sequitur. He has an unhealthy love of history, and I love him for it. But yeah, I'm not on that level.
You've put Kilmeade to rest for me. Thank you for that. Well done. Think of this as a third grader with a dinosaur obsession. Susan, anything else we need to get from Jimmy before I let him go? I don't want to
Jimmy,
keep him
do you have
too
any
long.
questions for Dr. Drew? Because this is called Ask Dr. Drew.
Oh, you dang right it is. Well, first of all, Monday night show. Okay, you should know I'm excited about this.
Yeah.
Kat and I were just talking about it on my radio show a little while ago. Are we basically doing this with a live audience?
Basically, I thought a little bit of a Gutfeld-esque quality to it too.
Okay.
But yes, we'll get audience interaction. We'll get your thoughts. Yes, I have some things I want you guys to talk about. Yes.
So when you say, all right, so a Gutfeld-esque quality, do you want me to dress as if I'm 5'1"?
No, I don't want you to be Gutfeld. I want you to wear one of your crazy coats. I want you to be Faila.
Oh, let me tell you something, girlfriend. If you want a just for the occasion outfit, for real, because I have a couple of jackets that shock the conscience. That like I've been, every once in a while you get a phone call from wardrobe, not an email, because they can't say the things they want to say in writing because it's corporate America. But I have a couple of jackets that have elicited a phone response that I'd be happy to unveil Monday night if that's okay with you.
Ooh.
I'll be happy if I confuse you with Divine.
Well, I tell you, like my hook, Drew, for real, is like I look like a figure skater who let himself go. Like I used to be the guy winning gold medals in like flamboyant outfits, and they hoisted me up at the end of the routine. And now I've got to be the guy doing the hoisting because he can't pick me up. That's kind of the hook of what I'm going for. So yeah, you'll see that.
Right.
Not quite a Chip and Dale, maybe a chips and dip, if you will. But I'll be there.
And before I let you go, any question for me, as Susan put it? We got to get. It's all questions today, so we're not going to let you go without a question.
Oh, you want like a real Dr. Drew question? Absolutely.
Yeah. Give me a question.
No. I think this is a good one. Okay. Where are you weighing it? Where do you weigh in on the sugar battle? What I mean by the sugar battle is, okay, when it comes to just weight loss, okay, because I have a stand-up special coming out.
Yeah.
And I don't, I'm not telling you I want to look like a bikini model, but I also don't want to look like a before model.
Yeah.
So in the process of prepping for that, I usually try to eliminate sugars from my diet as the quickest expediter to weight loss. Am I doing something right or wrong here?
You're doing something right, but it's not likely to do a lot.
Ah, hell.
Right? I mean, look, the enemies, simple sugars and starch, anything that approximate cake, anything cakey, anything pure sweet, you're not doing yourself a favor metabolically. If you have metabolic syndrome like me, it actually affects your lipid metabolism. Insulin resistance is enhanced. It's a thing. You have to be careful and I suspect you're similar to me in this sort of biology. And so you have to pay attention. But in terms of, there's several different things. Weight loss is one thing. Weight maintenance is another thing. Health maintenance is another thing. And fundamentally, the diet you'll do is the diet I want you to do. If you find one that's worked for you losing weight, but you're not going to be able to stay on anything long term unless you get kind of a sensible thing going. And Susan, do you want to ring in with your V-Shred stuff? I know she's itching to come in here.
Oh. Also, you can't eat certain oils, right? Seed oils.
You want to avoid seed oils.
Like
you want to avoid those bad oils.
Canola oil, anything with
oils.
canola oil.
You want to stay with butter and fat and avocado if you can, olive oil, proper olive oil, real olive oil. Okay. It gets a little complicated.
And we have a sponsor or an endorsement. Drew has been
then exercise. He's
endorsing something called V-Shred, and I don't know if you've ever seen the ads of us prancing around, working out, and talking about the diet. Actually,
He's going to look it up now.
Yeah, the diet.
This is going to be part of the Monday deal.
Yeah.
Trust me, he's going to attack us for this on Monday. So
yeah, well,
Stop it.
Drew was a carnivore for 4 years.
yeah, I
He
was on
didn't
carnivore
eat
for 4
any
years. I was on
carbs.
no carb, no anything for 4 years, just meat.
And
not
I would
many
have
beef
to
and
like
eggs.
cook 10 pounds of steak every Monday.
And turned out I gained a bunch of weight.
Yeah.
At first, it was really good, but for on a sustained basis, it wasn't so good. So there you go. Listen, I'm going to let you go, my friend. I see you looking.
But anyways, we're eating carbs now, and we're losing weight, and we're staying in shape, and it's awesome.
Yeah.
And
I lost 14
both
pounds.
done
I
the
love
plan.
this.
It worked out.
This is something to talk about Monday, because the truth is, like, for TV, I always say, like, I'm surrounded by TV stars. I look like I installed your TV. Okay. It's a superpower, but I also need to be mindful because I'm in a very aesthetic visual medium. So I will come armed with questions and treat this like a semi-serious conversation. There you go.
Okay, great. Jimmy, thank you so much
We
for being
love
part of
you.
it. We love you. We'll see you soon. Okay. Take
Rock
care,
and
buddy.
roll Monday. Bye.
The great Jimmy Faila.
Ta-ta.
Follow him on X at Jimmy Faila, F-A-I. 2 L's in his name?
Yes, 2 L's.
Faila.
And you
Okay.
can find him at Jimmy Faila on
Okay.
Twitter and all the
You
other
guys have been
places.
very patiently standing by while we've got lots of calls.
Give him
coming up here.
give him a shout out. He's a nice guy.
He is a nice guy. Let me try to get to your calls here. I'm sorry that we were sort of vamping there for a minute. Let me try to get Mike up here and see what Mike wants to talk about. Sorry, guys. We're indulging ourselves. We got a little time left here.
It's funny. A lot of diet questions have come up in the last couple of days.
Yeah,
you know?
and the guy that asked me a diet question yesterday DM'd me again, like, no, I want real specifics. Like, you can't. I opened by saying, look, the biochemist I admire most is the one who says you can't really say much about real specifics about nutrition. It's too biologically complicated. There are certain things you can say, and I say those things. All right.
Try the V shred. You might
we
like
lost
it.
Mike. I lost Mike again. We will get to.
I do. I'm very picky about diets too.
Yeah, I know.
It's basically what I would cook normally, but the recipes are very good, and it's easy to follow, and you can stick with it and see the weight fall off, and then you're amazed because you had like a taco and you lost weight. Like, oh, look at that.
This is Yolanta. Yolanta, a chance to come in. There you are. Mike dropped off. Hey, Yolanta. Got to unmute that mic.
Hello. Yeah, I'm there. Yeah.
Hey there.
Thank you very much for letting me ask you some questions. I've just listened to the lady that was asking about the vaccinating elderly. I've got a couple of questions. It's still concerning COVID and the vaccines in total, of course. Let me ask you another question. Have you read the Turtles all the way down?
The Turtles all the way. I am familiar with that. Yes, I've not read it. I've not read it carefully. It was recommended to me when I was still very dismissive of anything anti-vax. Now I'm listening. I'm still not. I am not in that camp. Let's be clear about this. I vaccinate people. I understand people are concerned, but go ahead.
Okay, but if you will get to this book, realize that it has been published in 2018 or 19 already, before all this debacle has started.
Oh yeah. Oh no, it was. It was the anti. Listen. So I don't believe it. Well, I'm going to say this. I have friends that are. I don't exclude somebody from friendship because of their belief system on vaccines, and some of my anti-vax friends were like, "You got to read this book," and I was like, "All right, okay." I couldn't read it carefully, but so go ahead.
Okay. Yeah, it's. I'm not an anti-vaxxer. I haven't taken the COVID jab, but I have been vaxxed up to my eyeballs. Apart from I never had the flu vaccine because I just couldn't really face the ideology behind this. That we are taking the shots with the material from last 3 years to protect us from the common flu strain.
Well, we in spite of that, we would generally capture about 60% of the flu viruses. We would generally do okay most years. That's pretty good. I want protection against that. I want my elderly patients to be protected against that. You got to remember, flu kills old people. You got to remember that.
Yeah, I know. I'm a doctor as well. The thing is that, even Dr. McCulloch recently, I haven't personally looked into the detailed data about the flu vaccine, but apparently there are publications already showing that they are
So
about
Yolanta, let me talk to you about
16%.
let me ask you something else.
Yeah.
This is something I want to. Did you hear me talking about how adulterated the patient-physician relationship has become? Did you hear us talking
No.
about that? Okay, I want
Was
to
it
ask you about
today?
this.
Yeah.
What's that?
Was it today or on the previous
No, I did. I
spaces?
said it about a half an hour, 20 minutes ago. I was talking about it. But
I
listen,
see.
are you practicing
Yeah.
medicine in the United States?
No, in UK.
UK. So
Yeah.
here, the relationship between the doctor and the patient has been adulterated by insurance companies and hospitals that employ doctors and the state agencies. It's adulterated, and physicians have been trying to break free from it for 30 years, and it's only gotten exponentially worse. I'm of the opinion that the physician, a highly well-trained and caring physician, and a motivated, informed patient is your most effective, most efficient unit in medicine, period. Okay?
Yeah.
And that has been adulterated on the physician side by all these employees and financial distortions and drug companies and all these things. I want to put some of the control back in the hands of the patient. Do you agree with that we should be helping patients be the locus of control for their own health care?
Absolutely, but based on the fact that you've got to give them all the information that is available, and not all information is even available to you.
Yes, this is what I thought you would say, and I agree with that, which is why I'm trying to be open to everything. And in science, in biology, getting at the truth is really hard. It's really hard, and that you also know that our clinic. Say it again.
It got even harder based on the recent experience with when you look at the literature that is accessible to us and what is published and the quality of what is published.
Yes, ma'am. 1,000% true. Yes, it's mortifying to me. I never thought we'd be here, but here we are. So we agree. And so I just think that rational uncertainty on everything is the right approach, that trying to approximate the truth as best we can, but that our clinical experience has meaning, right? That your and my clinical experience has been washed out of the conversation of what's going on here. It's all about the literature only, and no one talks about what physicians are seeing. And when you do talk about what you're seeing, you're attacked for it. Do you agree with that?
Yeah, that's very true. Yeah, you are not allowed to have experience anymore. You've got to follow the protocols and the boxes. Yes.
That's terrible. And so my experience cuts both ways, right? So I'm telling you, like, elderly patients, I'm able to get them into their 90s. I'm an internist. I vaccinate them all. It's kind of working for me, and I've not seen any side effects. That's my clinical experience. I also fought like crazy against the Women's Health Initiative when the national gynecologic and obstetrical societies told me that I was literally these words, I was a witch doctor if I dared to give hormone replacement therapy to a woman. And I said, it's going to destroy a lot of women. It did. They all turned into immobilized spheres with fractured spines. It was atrocious because these societies all took a certain position. I'm worried about all of this now. There's all these very strong positions that organizations are taking. They have been wrong in the past. Are you worried that they're wrong now?
I allow this possibility to come in fruition very soon, actually, because there are several things that has been sort of debunked, or at least I have learned more about them. Like, for example, the anti-cholesterol drugs and the role in the preventing heart attacks. Now, what I'm thinking about as well, I would like to ask you about it. Like, when you are familiar with the Cleveland Clinic study that they did on the amount of jobs all the people that are employed in Cleveland Clinic took.
Yes, and they got
And
sick.
what
They got sick, more likely to get sick
they took.
afterwards. They're more likely to get sick with the
Yeah.
vaccine than not, correct? Isn't that the outcome?
That's right. And the more they took, the more sick they got. Now, my question again, I was a bit slow to make this a thought process, but when you think about elderly or when you think about a immunocompromised people, you are sort of prepared to vaccinate them because you come from the point that their immune system is malfunctioning in terms of it's senile for the elderly, or with the immune compromised, it's not working properly.
So let's be fair. So the elderly, we know they're at risk for a variety of reasons, right? I don't think so much about just their immune compromise. I think about all the different mechanisms that the senescence results in issues. But the interesting thing that you made me just think about is if it's an actual immunocompromised patient, let's say with a chronic immune condition, the immunocompromise comes from what we give them. From the medication we give them. That's where they become immunocompromised. So it's a kind of an interesting situation, right?
Yeah. This is my question. So how should we expect them to respond, for their immune system to respond to this stimulus if it is not, if it's unlikely to respond without it? I mean, normally it's not responding.
I don't know if you've seen, I've only seen that data as it pertains to COVID. And they give extra vaccines. The rheumatologists are giving more vaccine to some of those immunocompromised patients. They're giving bigger doses, more frequent.
Okay, but just to simplify it, don't you think, or am I just simple, that it sounds a bit illogical?
I'm with your thought process, and Yolanta, I've got to say goodbye. I've got other callers that want to come in, but I appreciate you making me think it through. I want to be thinking things through like that all the time. And yes, please continue to ask those questions. Let's see. This is Kayan. I'm sorry to have to cut you off because I've got other calls I've got to try to get to here. Kayan, you didn't come up for some reason, even though you're requested. That's weird. I'm going to remove Kayan and I'm going to ask him to come up again. Whoop. Okay, Kayan is caught in a loop of some type. Let me bring Josh up real quick, and Josh knows how to
someone
work the
up.
system.
I have a quick
Dr. Drew.
I will. After him.
Okay. Hey, Josh, what's happening?
Not much. So I just wanted to talk to you about what you said. You woke up in the middle of the night and you were kind of, confused about where your position was. And I feel like it's okay to be ambivalent about the medical community. I think that's what makes you a really good doctor, is that you're willing to question what's been placed before you. And you definitely have some real concerns. The funny thing here, and you'll probably be upset with me for saying this, is, you kind of remind me of what happened with psychiatry. We sort of turned against science in the 60s. And like Foucault was someone who turned against the prevailing wisdom of science. And you almost remind me of Foucault. You almost remind me of Foucault today, because you're trying to tread that line. Obviously he's a philosopher, you're a doctor, so it's very, very different. But I just had that something came to me.
But I get what you're saying.
Is he doing Foucault in the 1960s?
No, it's a great question, and I don't think I hope I'm not. I don't think I am. But what's tough for me is because I'm doing this publicly, people have to watch me struggle in real time. Some people like that. Some people hate that, and it's always the way I've done it. And by the way, when I've been overly certain or hubristic, it's been to my detriment and been a mistake. So I kind of feel like struggle is, I'm advocating for rational uncertainty. I want to be a model for that we struggle with things. I'd like to get close to the truth. I'd like close to getting it right, but to really get something right takes time. In biological sciences and medicine in particular, it takes a while for things to sort of clarify themselves over time. And that's the part that we aren't giving each other. We really sort of aren't giving each other that chance. This is Health Uncensored. Thanks, Josh. Trying to get through as many people as we can here. Health Uncensored, unmute your mic there, and let's see what you got.
Hi, Dr. Drew. Thanks for allowing me to come on and speak. My question is, what's your take on vaccine-induced viral reactivation, and what role does that have in vaccine injuries? To give a bit
what do you
of
mean by
information,
what specifically? What do you mean by viral reactivation? Which
vaccine-induced viral reactivation? I mean, taking a vaccine towards a targeted pathogen, let's say COVID, and a byproduct of receiving that vaccine is significantly raising the risk of activating dormant viruses you're already carrying. Let's say shingles, for instance, herpes zoster, as a byproduct of taking a COVID vaccine.
Okay. Tell me more what you're thinking, because I don't have a strong opinion about this. My sense of, I mean, you'd have to come up with a mechanism for it, and that's pretty complicated. But I will tell you that things like shingles can get activated from almost anything. So it worries me if we're using shingles as a paradigm.
Well, shingles actually, from what I've read, only occurs in the immunocompromised and the elderly, from what I've read. If the immune system is suppressed.
Nope, it occurs. Nope, it's predominantly in those populations, but it's all over the place. I see it all over the place. Healthy people, young people, all kinds of people.
An example of vaccine-induced viral reactivation and the potential connection to various conditions and diseases. A great one would be autism. There's a lot of research going back to the 70s showing a causal association between viral infections and autism. Things like rubella, things like CMV, things like herpes simplex. There's case reports showing how people have an episode of viral encephalitis, and from there on out, they qualify, clinically speaking, for autism spectrum disorder. They meet all the diagnostic criteria.
Right. So there is no doubt. There's no doubt that an inflammatory brain condition in childhood can result in massive alterations in development. Massive, massive, massive. And sometimes, if it happens early enough and significantly enough, it will lead to a autistic spectrum type picture. But again, it's a broad category. But yes, certainly, for sure, there's no doubt that can happen. Now, whether or not vaccines can activate something, I only have the consensus. Again, if there's some other consensus brewing, I will keep an eye on it. And the consensus is that's not the case. But, all I can tell you, I was totally dismissive of that 2-3 years ago. Now I'm watching, reading, seeing if anything crosses my path. Listen, Caleb, you said you had a question. I rolled right past you. What was that?
Yeah, I had a quick question. I specifically didn't Google for this because I wanted to get the answer on the show from you. But when my wife, when she was going into labor with the new baby, I noticed whenever they plugged her into the epidural that in big letters, the epidural says that it's fentanyl. How is fentanyl as an epidural safe for a pregnant woman to take by an IV when she's pregnant?
Fentanyl, there's no medication that people abuse that can't be used therapeutically to good purpose. And fentanyl's been around I've used fentanyl 1,000 times. It's a good analgesic. You get to use very little, has to be done extremely cautiously under very controlled conditions. It's a very powerful analgesic and perfectly fine.
Does
it's
it
just
not,
that if you're using it on your own, you can easily overdose with it and die. But and all opiates are essentially the same. I mean, in terms of their effect on the body, they have no effect on the body. They're harmless. They don't hurt the body. They just make you not breathe if you take a lot of it. And if under controlled conditions, you get pain control.
Right. I guess that's my question is I guess I just automatically assumed that any use of any opioids for someone who's pregnant could pass on to the baby in some way. And I just didn't understand why fentanyl.
Sometimes there are ways that can happen. There are ways that can happen, but it doesn't because it's in the spine. It's just in the spinal column. It's being localized in the spinal column. Okay. But let's say we did give your wife some opioids. It's fine. The baby will, the baby's not going to go have withdrawal from a single exposure to opiate. You know what I mean?
Right.
Nor is he or she.
I mean,
it can affect their they can affect their respirations, and I'm sure the doctors will be watching that very carefully. But it's not that big a deal. Look, we used to use patients coming off heroin. we used to use to detox the babies. We used to use anti-diarrheal medications, and that was it. That's all we used. We give them paregoric, and they'd have some irritability for a couple of days, and that was it. Now, people have made much more of babies in withdrawal, and they've got a more sophisticated approach to it, but it's still a much milder syndrome than people think it is. And people get too wrapped up in, the what they hear, fentanyl bad.
That's
fentanyl.
What happened.
Fentanyl. It's a drug that's been around for a long time. It's still very useful.
It was just shocking to see, because you see fentanyl in the news all the time, and then to see it in a label there, they just bring in this case, and I'm thinking, geez, there's that drug that their cartels are fighting wars over, just coming in this case here, plugging it into my wife's spine. But that's I guess the other question there is that if someone, let's say someone is knows that they're an addict and they're pregnant, but what do they use? Is there an alternative epidural, or is this different because it's going straight to the spine?
It's a really interesting question. The answer is yes and no. There are alternatives they could use. They usually, just because somebody's a drug addict doesn't mean they shouldn't get analgesic when they have a surgery or something.
Right.
It's just what happens is that when let's say I remember Shelley from Celebrity Rehab. She has this great story about how she woke up from a surgery with a morphine pump on, and she'd been sober at that point a few years, but just being in the presence under the influence of that drug, all of her crazy thinking came back, and she immediately began manipulating the nurses for more drugs. She got angry, irritable, started splitting, started doing all the things that drug addicts do. And if somebody's not there to get her off the opiates and get her back landed in the program, she could easily leave the hospital and start pursuing more drugs.
Right.
So that's the problem, is that it activates all the terrible thinking.
I've told you this before, that whenever when I was in the hospital for those 9 days back in 2020, I did two or three hospital stays there. When I was in so much pain from my Crohn's disease and my psoas muscle and everything, they would plug me into an IV with Dilaudid. Now, I've never had any problem. After the hospital, they gave me Percocets and everything, and I tapered off fine. I've never pursued any of them. I don't even like them. But every time someone on the show says the word Dilaudid, I feel a little warm. And I'm like, oh, there was one positive thing with all of my suffering when I was in the hospital, was that I knew that second hospital trip, I could go back, they'd plug me into the Dilaudid, even though I've never tried to. Right. How does
everybody,
that, why is it in my
likes
brain?
Dilaudid, everybody. Caleb really, really likes Dilaudid. I will
not
tell
enough
you,
to chase
I understand. You've verbalized it every time. Every time somebody mentions it, you go, oh, Dilaudid.
No,
you literally say it out loud.
Is it from...
But here's the thing.
Here's the thing. From the Dilaudid itself, or is it because I was in so much pain and it relieved the pain and my brain
No, it's
programmed?
the Dilaudid. It is the Dilaudid, and not everyone has a positive experience to opiates at all, right? I get kind of dysphoric from opiates. I don't like them. I hate them. Would I like Dilaudid? Maybe. I don't know. But we all have different genetic constructs. And maybe that's your tiny, tiny risk for addiction there, telling us it's there.
Right.
You might have a little risk with certain opioids or certain something.
Yeah.
The risk for addiction is a spectrum from exploding the first time you expose yourself to alcohol to something like you're describing, where if you also had trauma, childhood trauma and emotional dysregulation, and were seeking relief from that, maybe you would be more prone to head towards that Dilaudid a little bit, and maybe it would activate something we call addiction. I don't know. It won't happen. Don't worry about it. It's not an issue.
I just remember my doctor at the time is because I was in so much pain, they put me on, I had so many Percocets just in big bottles.
Yeah.
By the end, whenever I was out of pain, I was like, oh, well, I don't need these. So I just got rid of them through whatever the secure thing is, you get rid of the pills. And I was like, well, I guess I don't have the addictive gene to opioids as strongly.
No, you don't. Not enough to trigger something.
Right.
Not enough to really trigger something. So it's not something you have to worry about. That's for sure.
Right. I do
my friend.
Also that second time I went to the hospital, I was like, God, I'm in so much pain. This is the worst. But at least I get Dilaudid. So I guess there's 1% positive to all this horribleness going on right now.
So here's what a real addict does. So Tom Arnold has a story about, I think it was Tom, where he got in a motorcycle accident, was laying in the street bleeding, and he was in terrible pain, and he heard the ambulance coming, and he became overwhelmed with the notion, the following thought, oh my God, this is going to be awesome. This is going to be fantastic. I'm going to get morphine. So psyched.
Man.
He was just like, oh, this is the best. Just at hearing the siren from the ambulance. So that's drug addiction. That's drug addiction.
Well,
so different, right?
Yeah.
Yeah.
Thanks
So
for answering.
Caleb, let's go over all the particulars about next week. Again, we have noon time or 11:30. Please check us with Christine Anderson next Tuesday. Then the usual times, 3:00 Wednesday and Thursday. Dr. Victory will be with me on Tuesday and Wednesday next week. And then we are Monday night at the Chelsea Music Hall in New York City, underneath the Chelsea Market, with Jimmy Faila and Kat Timpf and now Kennedy.
Live.
Thanks to my
in the
wife's,
flesh.
Thanks to Susan's, what did Jimmy call it? Fire hose texting. got Kennedy dragged into everything.
No, I just invited her. She just wanted to be a part of it.
50% off. Oh, we have a new channel at kick.com/DRDREW. Caleb set that up. And a reminder, you can get 50% off at drdrew.com/NYComedy using the code Drew, DREW.
Early show Tuesday.
Early show?
We're doing it early on
Oh,
Tuesday.
we're doing the show on Tuesday. Yeah.
I know. We have a new time slot. It's not great for our regulars, but just try to remember.
But I don't know if it's going to be 11:30 or 12. Please keep an eye out for that. I don't think Barsh actually sent us a clarification text. She did not. I think it's noon. That was the last email I got, but it should be good.
11:30 would be better.
It would be better. I agree. But we'll see.
You know what, guys?
It was Christine.
As soon as we get this baby into a better sleep schedule, I'm going to make a schedule page on the website so everyone can go there and get the most up-to-date stuff, and we never have to do this again. I'll fix it.
And a shout out.
Oh, it's charming.
And
it is.
A shout out to the TWC people who we are working with very closely now. They've been a pleasure. They are allowing me to put things together the way I want to and to try to, again, bring that locus of control back to the patient. The emergency kit is the beginning of those ideas. I just have always thought people should have travel kits and should have first aid kits and should have ways you can educate people to use these things. There's no reason they shouldn't have them. And so that's what they're helping me put together. So it's a pleasure to be a part of their world. That's TWC, the wellness company. And look for more coming from them. Susan, anything else before I wrap this thing up?
Check out V-Shred.
Okay, I had a feeling that was coming. Check that out. And I've got to go do my V-Shred right after this. So thank you all for being here. Thank you for the calls. Thank you for you guys on Restream. I've been watching you. And of course, the Rumble Rants are always a pleasure. Susan's been over there with you guys. Talk about why smoking is bad. No, tobacco is all bad. It causes heart disease, causes vascular disease, causes emphysema, causes lung cancer, actually is associated with several other kinds of cancer as well. It is a carcinogen. Let's be clear about it. Tobacco is the problem, not nicotine, tobacco. All right, everybody, thank you for being here. We will see you next Tuesday at, I believe, noon. Check it out. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.
Gilbert Gottfried got canceled for tweeting about the Japanese tsunami. I promise you, there was no one suffering from the horrors of a tsunami that was checking American Twitter.
When you're getting your instructions to go home, what are they emphasizing?
Do not attempt to penetrate stoma. And it happens often enough that they need to underline it, bold it. Cap tells you everything I think that you need to know about men.
Yeah.
Because there was enough people being like, okay, I just went through this traumatic experience where my intestines out, and then my partner put his dick in it.
The one thing you must be is funny. You better be funny. All right, here we go. Drew and Booth Boys, this is for you guys too. I had a hydrocelectomy. Do you know what a hydrocele is? No.
Is it an animal?
No, it's a big cyst in your testicle, should you have testicles.
Yeah, no.
Over a cup and a half of fluid drained from my right ball. Maybe next time we do one of those medical examinations thing, we had to find somebody with a hydrocele. I got a nice big one. I went from a normal size. To a lemon-sized overnight. It was explained to me that hydroceles occurred due to traumatic injury. Yeah, infection. Neither of those happened to me. Yeah, they just sometimes happen. Any insight why this occurred rapidly and any way to mitigate the chance of a recurrence? Ooh, I assume, they just drained it. Mitigate the recurrence, they will remove them surgically. I'm not sure I would do that. And then as you see, if you recur, you just take the drain. That's all. I know that sounds gruesome.